Hello class. Today I'll be discussing methamphetamine abuse in the United States, understanding the impact and addressing the issue. Introduction to methamphetamine. By definition, methamphetamine is a powerful, highly addictive stimulant that affects the central nervous system. Chemical structure. Similar to amphetamine, used in treating ADHD and narcolepsy. Common names: meth, crystal, ice, crank, chalk. Forms: they appear as a white, odorless, bitter-tasting crystalline powder pill, or shiny rocks of crystal. History of methamphetamine. Early uses: first synthesized in 1893 by a Japanese chemist, widely used in nasal decongestants and bronchial inhalers in the early 20th century. World War II, distributed to soldiers to enhance alertness and endurance. Post-war, surge in recreational use, particularly in the 1960s and 1970s. Regulation was passed, which classified it as a Schedule II drug under the Controlled Substances Act in 1970, indicating high potential for abuse and limited medical use. Prevalence and epidemiology in the U.S. statistics. According to SAMHSA, approximately 1.5 million people aged 12 or older reported using methamphetamine in the past year. CDC data indicates that over 23,000 overdose deaths involved methamphetamine. Demographics: increasing use in rural areas, particularly in the Midwest and South, and has been a rise among people of age between 18 and 25 years. Trends: the number of people using methamphetamine has been steadily increasing over the past decade, with significant public health implications. So what are the risk factors in vulnerable populations, including demographics? Well, higher prevalence in rural areas, increased use among individuals with lower socioeconomic status. Some risk factors include genetics, family history of substance abuse disorders, environmental risk factors such as exposing yourself to the drug at an early age and high-stress environments. Mental health includes co-occurring disorders such as depression, anxiety, and PTSD increases the risk of methamphetamine use. Vulnerable populations, individuals with a history of trauma or abuse, and those with limited access to health care and social services. So what are the short-term and long-term side effects? Short-term: increased wakefulness and physical activity, decreased appetite, rapid or irregular heartbeat, increased blood pressure and body temperature. Long-term: severe dental problems, also known as meth mouth, extreme weight loss, malnutrition, skin sores from scratching, increased risk of infectious diseases such as HIV and hepatitis due to needle sharing, neurological damage leading to memory loss, cognitive decline, and emotional disturbances. So what are the signs and symptoms of abuse upon assessment? Well, the following are the physical signs: significant weight loss, dental problems, skin sores or lesions, hyperactivity, excessive talking. The behavioral signs are paranoia, agitation, violent behavior, hallucinations, delusions, repetitive motor activity. Psychological signs: severe anxiety, confusion, insomnia, and mood disturbances. Potential for overdose or use as suicide weapon of choice is a possibility. Overdose signs are hyperthermia, also known as elevated body temperature, hypertension, rapid heart rate, severe agitation, hallucinations, convulsions, coma, and potentially death. A suicide risk would be high risk due to severe depression during withdrawal. Individuals may use large doses intentionally to harm themselves. Keep in mind that it's important to form a care plan for this patient. The care plan will consist of a pharmacological treatment and non-pharmacological treatment. The pharmacological treatment consists of medications such as antidepressants to manage depression, antipsychotics to address psychosis, and medications for co-occurring disorders such as ADHD or anxiety. For non-pharmacological treatment therapies, you may want to introduce cognitive behavioral therapy, which helps modify thinking and behavior patterns. Contingency management provides tangible awards for positive behaviors such as staying drug-free. And lastly, motivational interviewing, which enhances motivation to change behavior. There are some additional aspects to the care plan that can be applied. For example, patient education. Topics that you may want to include are the harmful effects of methamphetamine on the body and mind, the importance of adhering to treatment plan, strategies for maintaining a healthy lifestyle, including proper nutrition and exercise. You may also want to introduce referrals. Referral services can include substance abuse counseling for ongoing support, mental health services to address co-occurring disorders, and social services for assistance with housing, employment, and other needs. Follow-ups would include regularly scheduled follow-up appointments to monitor progress. Monitoring continuous evaluation and adjustment of treatment plans as necessary is very important. In summary, methamphetamine abuse is a critical public health issue with several physical, psychological, and social consequences. Call to action: there is a need for increased awareness, more effective treatment options, and stronger support systems to help those affected by methamphetamine abuse. Thank you for your time.